Hello, welcome back to day number 12 of 12 days of COVID. This is the last one, and I wanted to talk today about the long-term effects of COVID. Now, most people don't have any effects past day number 10 or so, but it's known, and it's pretty well known and established now, that maybe up to 10% of people have lingering effects. Some of them shortness of breath, but mostly just feelings of fatigue for weeks and sometimes even months after they recover from COVID and are no longer contagious. So the reason why we believe is that COVID is a vascular disease. It attacks or it affects the blood vessels, even the very small blood vessels, to the heart, to the nerve, and to the lungs. And that's why we have such an assortment of symptoms. And we don't know if that's the exact mechanism for these long-term symptoms. There are actually some studies going on at some of the teaching hospitals in New York and in California who are studying people for months and plan to continue to study them for a couple years to see what the effects are, if any. So fatigue is the main symptom we see, and this seems to be a very real thing. The other symptom that I see a lot of people complain about, myself, and according to some of the research centers, are depression and anxiety symptoms. Now, right now, in my patients, whether or not they've had COVID, depression and anxiety are sky high. So it's very hard to determine once you've had COVID if that's coming from a COVID infection or that just happens to be present because of where we are in the world and with this pandemic right now and many other things. But that is a possibility, and it needs to be thought about. The main treatment, what I recommend for whether you have COVID and you have had COVID, is breathing exercises, and that has been recommended as a treatment as you're recovering from COVID to not only help your lungs expand and continue to move air well, but they also are recommended for anxiety. So it doesn't matter what you do, whether you have one of those post-surgical instruments with the little ball that goes up and down. If you have one of those, that's fine to use. It helps you be mindful about it. If you want to do some yoga type breathing, that is fine. If you have some anxiety type breathing and other type of breath holds and breathing exercises, those are all can be beneficial for anxiety, whether or not it's COVID related. The other symptom that people complain about a lot is brain fog. Well, brain fog sometimes can be anxiety related, so again, it's hard to sort out, but it does seem to be that there's a very real effect that people that have a certain amount of people that have recovered from COVID can have this long-term brain fog effect. So those are things to watch for, and when you are considering getting a vaccine, these are some unknown long-term effects of COVID that are out there, and we are hoping to learn more about. So thank you. If you have any further questions, please post them below. The YouTube channel on Verity Primary Medicine and Lifestyle will have all of these videos from day number 1 through 12. Thank you.